just wanted to take an opportunity to thank my two heroes sitting in the middle of the room here, Senator Rosen and Representative Olson. Thank you for this. And I want to maybe just make some comments because we've been working on this bill for a long, long time. There are people in the audience that really hate this bill, but there are a lot of people that really love this bill. And the first thing I want to say is this bill is not perfect. We're going to continue to work on a bill that continues to do the right things for as many people as possible. But I will tell you that when Senator Eaton and I started working on this bill when I first arrived 5 years ago with this concept and this really high-level idea, it gave us this feeling that we could actually get it done. And I think between this work that we've done and with our friends here at the table, we're here. And we're one of the first states to figure this out. And we are doing it in a way that I think exemplifies why shared government can work. Because you hear in the headlines over the last weekend how challenging it has been to come up with a budget deal around here. It has taken us to the very last day of this session to get this done. Because it's not easy to share our ideas sometimes. But what we have done here with even this session alone, the four members, the two chairs here and Senator Eaton and I have been meeting with some staff members before session started to make sure that we had something like this to present to our citizens in Minnesota. But we need to look at this bill as a very first step and a bold step, and it's a simple step. I think $20 million, when you start looking at the overall picture of what the cost has been to our communities and what the profits have been for certain companies and just where we are at today, 20 years after this whole epidemic started and our whole society was almost frozen because we didn't know what to do for a while. I am so proud to be a legislator today. I cannot tell you that there's more days I'm not happy, but today is one of those days. I am so honored and proud to be on this side of the table where I feel like I can help make a difference in a small way. But doing this in a shared manner, when we sort of bicker back and forth and we got to have this and got to have that, this is a pretty darn good bill. We've been calling each other and texting each other all hours of the night in the last 3 or 4 weeks. And I just want to say, if you are thinking of getting on the advisory council, if you're one of those members out there that's sort of thinking that this would be a great thing for me to be on, get ready to work, because this is just the beginning. Our job is massive, and our work is going to be huge because we are going to save a bunch of lives with some money that we didn't have yesterday, and it's going to take us a little while to bring the money in. I sure as heck hope there aren't going to be any funny shenanigans from people outside of this room that make this difficult for us to try to bring in some money. But I just want to put a word out to Governor Walz, get ready. There's a bill coming your way, and I could not be more proud today to be a part of the team that put this together. So again, thank you, Chair Olson and Chair Rosen, for your great work, and for, again, all of us sitting here at the table. Chris, we did it. And this is an amazing day, and I'm so proud that we can kind of hold something up that we can know is a great start to even better days ahead. So thank you, chairs, for letting me do that. Thanks.
Further member discussion. Senator Eaton.
Thank you. I don't quite have the gift of gab that Representative Baker has, but I share a lot of his sentiment. It's this road both of us got on when we lost our children to the opioid epidemic has been a rough one. We've worked hard, and I think we have a good product here. I'm hoping that it makes a difference and saves lives. I think it's important that we make sure that we continue to fund the naloxone. We saved over 2,000 people last year, and that is my concern with the cut to the Steve Rumler Hope Network. It wasn't available to my daughter when she was overdosing. the police officer who got to the scene couldn't carry it, and we took care of that with this Steve's Law. And now, a lot of that, the people who use it are trained by the community organizations, including Steve Rumler Hope Network and Valhalla and a number of others. And some of that funding has been cut, and there never was enough to begin with. So that was my motivation for this bill, was to make sure that we could put resources in place. As long as we prescribe opioids, there's going to be people who are addicted to them, and it's a side effect of opioids, and people are going to need help. They're going to need treatment. They're going to need resources, and hopefully this bill will provide some of them. I'm proud to be part of it, and I'm grateful to Senator Rosen for carrying it through the Senate, and Representative Olson for carrying it through the House. And Dave's been a great, Representative Baker's been a great partner throughout the process. And I'm just looking forward to the formal signing ceremony.
For Representative Halverson.
Thank you, Madam Chair, and thank you, Representative Baker, Senator Eaton, for your vision so early on. And to you and to all of the parents and family members who came and testified in our committees for years while these legislators worked to get this over the finish line. Thank you for taking what was no doubt the worst day of your lives and working so hard to make sure that other families don't have that worst day. I guess I wanted you to know that I see what you're doing for the rest of the state of Minnesota, and this bill stands as a testament to that. Senator Rosen, you have shown up day after day, year after year, making sure that this didn't fall by the wayside, and really appreciate that. Representative Olson, your leadership has been tremendous. Thank you for allowing me to be part of your conference committee, because this work is incredibly meaningful. And Representative Baker, I couldn't agree more. This, sometimes we get it right, and not perfect. But I think I'm grateful to everybody who showed up here to have hard conversations and kept coming back, even when conversations were challenging and difficult, because I think we were all here to make sure that we got the best product possible for the people of Minnesota, and that we did the work that you families have asked us to do to make Minnesota a healthier and safer place. So really, just grateful. I feel lucky to be a part of it, and I'm thankful to everybody who has worked so hard. And I also am looking forward to that bill signing, Senator Eaton. Thank you so much.
Senator Rosen.
Well, thank you, Chair Olson, and thank you so much to the members of this committee and all the staff that have been by our side and as passionate as we have been at the table. I can't express how much I appreciate your diligence and intelligence and your patience and your passion for this issue. I also cannot imagine what you, Senator Eaton, or Representative Baker have gone through all these years and these disappointments, the ups and downs. But we do have an ending here, and we have done some really good work. And sometimes these conference committees, you think, oh, the speeches, but the speech around this table and the speech to all of you out here in the audience that have stood behind, have helped craft this and mold this vision for this state is commendable, and I thank you so very, very much. And it's been a push and pull, absolutely. I'll never forget the day that John Magnuson came to my office and we talked about prevention for our children and how's that going to look. We have a lot more work ongoing, but this is such a huge start, and it does start with prevention with our children. But we have to get at the very core of these issues of why do we have a drug problem. And with this bill, we actually got at one of the reasons why we have an addiction problem with opiates. So that's pretty outstanding. I am very excited about pieces in this bill, the PMP piece. Thank you very much, Chair Olson, for taking that. There's a few clunkers in here too, and my apologies to the Steve Rumler Foundation. That was a clunker, and to the ECHO and the ECHO projects. That was just a problem with we both missed it on both sides, more on my side, and we are going to make that up. And I give to you, Chair Olson, that we will continue to work on the wholesalers. It is something that was not quite right. We will get the data. We'll work with the Board of Pharmacy, Dr. Weiberg, on that information, and thank you for your help on all this too. It's been wonderful. So, but this is not a finished product, but boy, it's a really good start. And you rarely get an opportunity to work on a piece of major legislation like this in your career, in your legislative career. So every one of you have been a part of this major piece of legislation, and I cannot thank you enough, Chair Olson, for working with you. It's just been a pleasure. So we did good. And we're going to get it past the finish line.